In the article, Presentation of Gender Dysphoria, A Perspective of Eastern India, written by Sanyal and Majumdar, is a study done from 2010 to 2015 on the medical, social, and mental health perspectives of those who are gender dysphoric. The study included 73 gender dysphoric patients who were being assessed, treated, and studied in the city of Kolkata, India. Each patient was diagnosed according to the DSM-5 as having gender dysphoria. Out of the 73 patients, 75% of them were male to female dysphoric. Currently, in India, as well as most other parts of the world, transgender humans are not supported and in turn harassed, ridiculed, and even abused for being abnormal, strange, or sick. More than 80% of the transgender patients did not even have family support for their gender dysphoria. Though each participant knew that they were gender dysphoric between the ages of 7 and 11, participants did not emerge as transgender until the average age of 25. Due to the negative connotation of being transgender or gender dysphoric, especially because of its presence in the DSM-5 as having a mental health disorder, the community is not supportive of this type of lifestyle. This lack of awareness has postponed many transgendered people to switch their intended gender through the act of dressing and medical procedures. This study then looked at biological factors to see if hormones and other medical statistics to determine if their gender dysphoria was actually abnormal or if they had anything wrong with their brain at different chemical levels in their body. After doing the research, each participant was within normal range and was no different than the average human cohort. Because of the negative stigma, both socially and medically, even though there are no medical differences between the transgendered people and the rest of the population, almost 17% of the participants chose to have gender castration, and nearly 2/3 of these were done from non-medical personnel. Due to this lack of medical and social understanding, many people in India, as well as the rest of the world, feel the need to take it upon themselves to get elective surgery without any medical attention. Though there is not a significant number of resources aimed at those who have gender dysphoria and are transgender, there are few national societies and organizations that concentrate on the educational, political, and medical resources needed to aid them. The National Center for Transgender Equality is an organization that focuses on the political equality and humanitarian rights for those that are gender dysphoric or transgender. This organization gives people who are transgender assistance with legal documentation, legislation that is discriminatory to transgenders, and education on the transgendered or gender dysphoric population. Gender Spectrum is a national organization that aids children who are transgendered. They've created summer camps, facilitated support and resources for both the children and their families, and hold conferences to educate others on the gender spectrum and transgendered children. Transgender American Veterans Association looks to influence public policy in regards to those veterans who are transgendered. They aim to promote equality in the United States, regardless of their gender, and work towards the endorsements of legislation that allows transgendered to get their fairness of veterans' health care resources and other assistance they may need. Collage, or Coalition of Lesbian and Gays Everywhere, is a program that was started in 1988 for children of lesbian and gay parents. Since then, the program has transformed itself into a program that also mainly focuses on children with parents who have gender dysphoria. Collage aids children and adolescents around the country through community chapters that meet regularly, education and outreach, and retreats that happen around the country. These retreats allow children to become empowered to stand up for equal rights for all family, as well as the understanding and education for the children. Trans Youth Family Allies is a program that aids parents in the understanding and support of what their child is going through during their gender dysphoria and becoming a transgender. Because of the severely low rate of acceptance, Trans Youth makes it a priority to raise awareness and aid in the prevention of transgender harassment and abuse through campaigns, community events, and education. Below is a list of our references. Thank you for viewing our slideshow. I hope that you were able to give some insight on gender dysphoria and its significance to the mental health world.